Hi, I'm Cortney Kenney, and this is my informative speech for the fundamental speech class. Okay, today I am going to talk to you about something that I'm very passionate about, which is special needs children. I have worked with them for many years, one in particular, and I'm sure in a roundabout way we all know somebody who is special needs, and it's a lot more fun and interesting when you know more about why they are the way they are and what makes them work, or why they think differently, or what makes them them. So today I'm going to inform you about a disorder called Coffin-Lowry syndrome, and it is a very rare disorder. It is not very well known, so my information is it's all the same from all the websites and journals that I have found, but there are a few interesting facts that I would like to just go over. I'm going to let you know kind of what it is, what causes it, who it affects, some signs and symptoms, and then the treatment process, and kind of a rough prognosis. They haven't really figured that all out yet, but kind of a rough prognosis from some doctors that have done some research on it. So my first thing that I'm going to talk about is what it is. Coffin-Lowry syndrome is, it's like I said, a rare genetic disorder that is basically the mutation of a gene. The gene is RPS6KA3. It is a gene that is on the X chromosome, so it affects both male and females. But since it's on that X chromosome, it affects males more severely. The females that generally have it don't show the signs and symptoms like a male would. So as I'm talking about signs and symptoms and differences there, I'm going to go kind of into that. With this disorder, they have usually very large hands, but when you think of large hands, it's not like lengthwise. They are very short. Their fingers are very tapered, and as you can see here on my little thing here, this little guy, his fingers have a little kind of, they're bigger hands, but they're short fingers and they're tapered kind of at the points, is kind of the genetic that mutates for the hands and stuff like that. Another mutation is like an underdeveloped jawbone. It shows right here kind of in the profile of this little boy right here. The medical term for that is maxillary hypoplasia. The other thing is palpebral fissures, which is like the down slanting of the eyes, kind of makes these little boys look like they're really sad and stuff, is kind of what it looks like. The other nice thing that you can see about the eyes is how wide they are. They have very wide spaced eyes. Something that you can't necessarily see, some features are like the prominence of the breastbone. Some of these kids, like when you see them, they stand very straight and their breastbone kind of tends to pop out. Something that can happen to a few of them, or eventually as they get older, is like a kyphoscoliosis or a scoliosis, so the curvature of the spine, and that can affect their heart. A lot of them have like a cardiac enzyme function problem with this disorder, so that kind of plays a factor into the prognosis of that. The other thing that you will notice on some of these little boys, they have some thicker like lips, and their forehead is very prominent. You can kind of see this one's covered up with hair and stuff, but it's very prominent. Another huge thing is they have major intellectual disabilities. There have been no studies that say why or what affects the brain that causes this, but there are many intellectual disabilities. They are usually very behind what their age level is. They also can have dental abnormalities as they have teeth come out. Sometimes the teeth don't always come back in, and sometimes they do, but they're just very wide spaced apart. Like I said, all the teeth don't usually come back in. And in very rare cases, they have some hearing and vision loss. So they also found in a study on the rare disease website that about 30% of these kiddos that are diagnosed with this have what they call SIDS, which is a stimulus-induced drop episode, whereas basically if they hear a loud noise or if something scares them or startles them, they basically drop. And nobody knows why. It's not really considered a seizure because they don't like shake and stuff like a grand mal seizure, but it's just kind of a drop episode. They lose their balance and it can be very dangerous. If they tend to have a lot of those happen, they will be wheelchair bound so they don't hurt themselves. Another thing that I would like to talk about is how they diagnose it. They usually can tell by like x-ray or imaging and stuff like that, but they also have found that there's an enzyme that they can study that they can culture and develop what is missing. Like a lot of these kiddos have decreased ribosomal kinase in the culture, so that plays into the factor of the Coffin-Lowry syndrome. I will say that this enzyme, when they have tested it, has only been found in the males. They cannot determine Coffin-Lowry syndrome in the female form doing this same study. So, as I said, it is a rare disorder. It doesn't affect very many. There affects usually 1 to 50,000 to 1 to 100,000 individuals. It is very rare, and that was through the European Journal of Human Genetics. The regular, I think the United States Genetics panel, the one that I looked up, they said 1 in 40,000 to 50,000 people. So they kind of broadened it a little bit more, but they are not usually, it's a very rare disorder. Another thing that they have found is it is a genetic mutation, so it is hereditary, but 70 to 80% of the people that get diagnosed with it have no family members or no inclination that they got it from a hereditary source. So 30 to 40% they do have a family background of it, but otherwise it is not known as to how it's considered hereditary and what forms it. Since it is through the X chromosome though, it has been factored in that that is why males are affected more, because they only have 1 X chromosome and females have 2, so they are less likely to have like the symptoms that I just talked about. A couple of treatment options. This is not a curable disorder by any means. The treatment options that I found are basically they have regular heart and spinal checkups through their doctors just to make sure that all that is progressing and see how it is looking and see if they need to do any treatments to surgery or anything like that to correct anything there. And they have hearing and vision exams. And the other side of it is like for the intellectual disability side of it is basically therapies for them to progress. Like they have speech and occupational and physical therapies and stuff like that to kind of keep them moving because they have low muscle tone and they need to work what muscle they have while they have it. The prognosis, like I said, it's not very well known how long they will live or anything like that, but according to an article in the American Journal of Medical Genetics, not many Coffin-Lowry syndrome patients live past the early 20s. And the author of that article, Alisar Hunter, he wrote about 12 patients in 1982. 1 had passed away by the time he wrote the paper in 2002. The other 6 that he kind of went back and researched and referenced, they had complications that included premature death, a loss of ambulation or ability to walk, or even became quadriplegic. They were not good outcomes at all. And nobody has found any records for anybody past the age of 30. So basically the life expectancy roughly is 30 because they have not found any records or data for any patient with Coffin-Lowry syndrome past the age of 30. The next point that I want to make, or why this is so important to me and what I have learned about it, is the little boy that I work with every day. He is one of the few that has Coffin-Lowry syndrome, and he has the wide set eyes, the flared nostrils, the large lips, the really chunky little, the hand that is the same size as my hand. Like his hand is literally the same size as mine, but these little short fingers that are tapered, and getting them to use and stuff like that is very difficult. But with our therapies and our stuff that we have done with him, he has had a very good outcome, and he is finally speaking and learning words. And as I said, it's a very rare disorder that just, it's kind of hard to watch them go through, but it's fun to watch him learn, and even more exciting when he gets something that he enjoys. Today I have told you about Coffin-Lowry syndrome. I have shown you some characteristics and told you the cause and the treatments and the prognosis and why this is so important to me. Thank you.